Okay, we're talking about the association of scapular kinematics in glenohumeral joint pathologies. Basically, the association between what your shoulder blade does and whether you have shoulder pain or not. So let's go to page 2, and we'll really look at what we mean by scapular motions or shoulder blade motions. So A here describes upward and downward rotation. Upward rotation is critical because it moves the acromion out of the way of the elevating humeral head. Internal and external rotation, or B, is what a lot of therapists will know as protraction and retraction. And again, if the scapula is internally rotated or protracted, that shuts down the subacromial space. And finally, probably the newest and most important acknowledgement of why scapular mechanics are so important is posterior tilting of the shoulder blade, because this, as you can see, moves the tip of the acromion out of the way, especially if you have a grade 2, grade 3 acromion with a hook here. So as we learn more, we'll discover that a tight pectoralis minor can cause anterior tilting, or slouch posture can affect anterior tilting, and then lack of strength or lack of muscle tension, correct muscle tension relationship of the muscles, meaning the rhomboids and middle traps, serratus anterior, can cause a lack of posterior tilting, which affects the shoulder. So as we just thumb through this article, we'll go through a couple pages here. Let's see. Alright, as we go through here, right, talking about thoracic posture, right here we'll highlight this. Alright, there really is a big alteration. If you look at baseball pitchers, you look at swimmers, when healthy subjects are asked to assume a slouch sitting posture and elevate their arm, they had reduced upward rotation and posterior tilt. These are the two critical things you must have in order to prevent impingement of the shoulder. Likewise, it will cause increased scapular anterior tilt, which again closes down that subacromial space. So what this review article talks about is what must be done is, and what's proven to be helpful, is serratus anterior strengthening or retraining, right, upper trap activation reduction, which means quieting the upper trap, posterior shoulder stretching, which is a sleeper stretch, pectoralis minor stretching, which is on the foam roll, and thoracic extension posture and exercise. So these are the biggest things to help with the scapula that must be addressed in all performance programs, as well as programs that will prevent subacromial shoulder impingement.